Hello, my name is Dr. Steele. Today, I want to talk to you about something extremely important because as we get older, we need to not only prevent, which means prolonged life, but also detect early. And we do control things to do that, right? We control our diabetes, means our sugar levels. We control our cholesterol. We control our any other deficiencies, vitamin D, testosterone, thyroid, whatever we can do to control to live longer and stay younger for longer. So one of the tests that I do recommend that is always not new, but it's been around for a long some time, but now cardiologists are actually asking for it. And it's not invasive, meaning they don't need to inject anything on you. They don't need to do anything extraneous like exercise. It's something called that I like to do, calcium score, CT calcium score. What does that mean? Let me give you an analogy. You know how the water that we have, especially here in the area that we live in, instead of having soft water, we have hard water. What that means that if you use your shower head or any other medium to run your water, eventually you're going to have stuff a build up. Some stuff, minerals are building up on those pipes. The same thing may happen in our pipes, meaning our arterial system, especially what I'm looking for is your coronaries. So if you have a lot of calcium around your coronaries, that tells me that you may have a risk of having a heart attack. So what we do is a quick picture. It doesn't take that long. And we take a picture of those coronaries. And it's just a number. I'm not saying you need to remember this, just a number. If any of those vessels have greater than 300 calcium score, that means we need to do further testing because you're a higher risk of having a heart attack, because that means you have moderate to severe disease. So what I'm saying to you right now, it's not like I want you to be like super concerned, but it's a quick test that we can do nowadays that can tell us a lot of information. And always, even though we may have a procedure to correct that, the main way to correct that is to eat better. Because as Socrates said, be thy food, be thy medicine, everything stems from that. And that's my message for today. So just remember, it's just a test. It's not the only test, but it's a good test to do if you have any concerns, especially if you have family members that they have had a heart attack, especially primary relatives, like siblings, mom, dad, or if you unfortunately have risk factors like, and I'm just going to mention a few: cholesterol issues, diabetes means sugar issues, or anything that can make those vessels have plaques. And sometimes it's just genetics. It's just we were born just like that. But remember, we not only inherit our tendencies with our genes, but we also inherit our eating patterns, the way we eat, and our beliefs and how we take care of ourselves. Talk to you soon.